Let's dig deep. There's a new paper out from the National Bureau of Economic Research. This is a working paper, and they looked at shelter-in-place policies. Those were the orders given by governments across the country and really around the world to tell people they had to stay in their homes.
That was among the very first instructions from up on high that we were provided last March.
You got to stay home. You can't go anywhere. You got to stay there.
Unless you're an essential business or an essential
Unless you're one of the
employee.
special people. But everybody else, all you normals, you got to stay home. And it was, 15 days to stop the spread became months and months of social isolation. Well, this paper is trying to figure out if the shelter-in-place policies worked. Did they save lives? Because that was the whole goal of them, right? We're going to save lives by telling people you can't be around other people.
Okay, well, this is going to be a very interesting discussion because I'm wondering how did they distinguish between shelter in place being effective, non-effective, versus all of the other mitigation efforts in terms of wearing a mask, staying 6 feet away. Well, obviously, if you're sheltering in place, but a lot of that...
Part of that is they looked at...
In home, you spread it inside your home as well.
That was the most common place to catch COVID was in the home. That was one of the things. What they did was they looked at excess mortality. So how many people died in a given location compared to how many people were statistically expected to die?
Okay. I can see that.
So they looked at 43 countries and all 50 states. Here's what they wrote. We failed to find that shelter-in-place policies saved lives. To the contrary, we find a positive association between shelter-in-place policies and excess deaths. We find that following the implementation of shelter-in-place policies, excess mortality increases.
Wait a minute. You're saying that more people died in 2020. Well, wait a minute. But a lot of folks are going to say, well, of course, we had a pandemic. You would expect more people to die in 2020 than in past years.
So that's exactly right. They people are saying that, look, we got people dying of COVID, so that's why we had to lock down. But when you look at the data closely, there's no trend. Some places that locked down did have rising excess deaths before lockdown, but many didn't. So their excess deaths were actually decreasing. They then put the shelter-in-place order in place, and then excess deaths rose. There's no identifiable trend there. Does that make sense? And even some places that didn't lock down, you still have a rise in excess deaths, but it's no bigger or less than places that did lock down.
Well, I think at the very least you would have expected, if shelter in place was
successful,
you would have expected a decline in the number of deaths.
Not what happened.
I mean, at some point, comparing to previous years in terms of what the mortality rate might be in your community.
And that's not where it worked in most places. There were some places where shelter in place worked, but it was mostly islands. Here's what they wrote. Shelter-in-place policies seem to be more effective in island nations or the U.S. island state of Hawaii. The only places where they saw excess deaths decrease after implementing a shelter-in-place were Australia, New Zealand, Malta, and Hawaii. All of those places are islands. So if you have shelter in place in an island, you can stop the inflow of the disease better than you can in other places. Does that make sense?
Absolutely. Because we were all going to Walmart and to the Lowe's and the Home Depots and the supermarkets.
Yeah. So first, why didn't these things work? And the paper puts out some possible reasons that are worth exploring more. Okay? So this is what they say possible. First, it's possible that shelter-in-place policies do not slow COVID-19 transmission. The idea is that people in places that don't have a shelter-in-place order still have people that were already adjusting their interactions with others. Even before the lockdowns went in, people started wearing masks. Some people did, not everybody.
Okay.
Right?
Sure.
Some people were already socially distancing. They're like, I don't want to get around it. People were washing their hands more than they had been before. So some of those things were already going on. People were already doing things that were mitigating, so the shelter in place didn't really add anything that was more effective than what other people were already doing.
I know, but it's a bit of a misnomer to say we all sheltered in place because we really didn't. All you did was you increased the amount of time that you spent at your home, but that doesn't mean that you didn't go out
Ever.
in public
Right.
ever.
Second, it's possible that shelter-in-place policies increase deaths of despair due to economic and social isolation's effect of stay-in-place policies. Drug overdoses, homicides, and unintentional injuries increased in 2020. Here's something that is interesting. They found that suicides actually declined in 2020.
Not among young people, though.
The third, the existing studies suggest that shelter-in-place policies led to a reduction in non-COVID-19 healthcare, which might have contributed to an increase in non-COVID-19 deaths.
Yeah, we stopped preventative care.
You actually mentioned that. The day that John Bell Edwards locked us down, you mentioned that right here on this show. This study is saying you might have been correct.
You know what? You know what did increase, though,
What's
as a
that?
result of perhaps the shelter-in-place order?
What's that?
The birth rate.
No, it did not.
We weren't making babies?
We weren't. People weren't. That went down.
I'm going to check that out.
Actually, Ben Franklin, those who would give up essential liberty to purchase a little temporary safety deserve neither liberty nor safety. We gave up liberty, and we didn't get safety.
The birth rate should have increased.
It didn't.